A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant ruling on Tuesday, U.S. District Judge John Bates mandated that the Department of Health and Human Services, HHS, the Centers for Disease Control and Prevention, CDC, and the Food and Drug Administration, FDA, must restore critical web pages and datasets that were recently removed under an executive order from President Donald Trump. This decision comes in response to a lawsuit filed by Doctors for America, which represents a coalition of physicians and Public Citizen, a consumer advocacy group. The lawsuit argued that the abrupt removal of these resources not only jeopardized the health of patients, but also hindered essential research efforts aimed at improving public health outcomes. The judge's order specifically targets the pages and datasets that were removed or substantially modified without sufficient notice or explanation. Dr. Reshma Ramachandran, a board member of Doctors for America, emphasized the risks posed by the removal of clinical information, stating, "Federal public health agencies must reinstate these resources in full to protect our patients." The pages in question included vital information regarding HIV medications, guidelines on contraceptives, and environmental health data, all of which are crucial for both healthcare providers and the public. The controversy surrounding the removal of these pages stems from President Trump's executive order that aimed to redefine gender identity within federal policy, which many critics argue undermines scientific inquiry and public health. The order explicitly outlines definitions of gender, reinforcing a binary understanding of male and female, which has been met with widespread backlash from various advocacy groups. Legal experts have pointed out that the judge's ruling highlights the importance of transparency and reasoned decision-making in government actions that affect public health. The sudden loss of these resources has put everyday Americans, especially those from underprivileged backgrounds, at greater risk, Judge Bates noted in his opinion. The federal agencies have been given until midnight on Tuesday to restore the specific web pages cited in the lawsuit. Furthermore, the order requires the government to evaluate and restore any other resources that healthcare providers rely on to deliver care. This ruling is seen as a victory for advocates who argue that public health information must be accessible and reliable, particularly in times of crisis. The swift removal of these pages prompted a frantic response from the medical community, with many professionals racing to archive the data before it was lost entirely. Dr. Joshua Sharfstein, a public health expert, expressed concern about the implications of the data removal, stating that it could disrupt disease monitoring and healthcare delivery. As the deadline for restoration approaches, there remains uncertainty about how much data will be reinstated and whether any modifications will persist. The ongoing developments in this case underline the critical intersection of public health policy and political ideologies, as well as the necessity for federal agencies to uphold their commitments to transparency and public welfare. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.